Welcome everybody. Today being the first day of Proficiency Challenge, first day, we will discuss something regarding National Exit Test first, then we will go to MCQs. In this exam, a student have to score 50% mark for private practice and even for state or central medical registration. The test is conducted biannually in February and August. Students who have joined internship from 29/11/2023 have to write this national exam. Students have to have an overall idea of all 12 subjects they had learned in homeopathy, and this will help you for preparing PG and UPSC exams. The MCQs are based on practical and real life situations which a homeopathic medical practitioner is likely to encounter. Therefore, multiple choice questions are structured to test the intellectual ability of the candidate. About 200 MCQs are to be answered in 2 hours time. So let's move on to the first question. The first question is the phrase odd sapere was coined by. Options are A. Hahnemann, B. Horace, C. Hufland and D. Hippocrates. Let's see the answer. The answer is the phrase odd sapere was coined by Horace. Odd has originated from Latin word orter, which means to dare, and sapere means to wise. So odd sapere means dare to be wise. Quote was used by Hahnemann for his medicine of experience. Next question. When vital force is suddenly overpowered by the disease, which one of the following modes of treatment is useful? First option allopathy, second isopathy, third homeopathy and fourth one is antipathy. Answer is D, that is antipathy. When vital force is suddenly overpowered by the disease, the antipathic mode of treatment is useful. It is said in footnote of aphorism 67. Third question, causa occasionalis means. First option exciting cause and maintaining cause, second option maintaining cause, third option miasmatic cause, fourth option fundamental cause. Answer is first option exciting and maintaining cause. Reference from aphorism 7 and footnote of aphorism 7. Fourth question, treatment of the so-called mental or emotional disease is mentioned in which aphorism of organon of medicine? Aphorism 105 to 145, aphorism 185 to 203, aphorism 210 to 230, aphorism 212 to 232. Answer is C, that is 210 to 230 of organon of medicine. So fifth question, name the chronic miasm of the following symptoms complains better by abnormal discharges, example leukorrhea, coryza, etc. Discharge acrid and corroding the part with a characteristic odor. Options are sora, tuberculosis, psychosis and syphilitic. So answer is C, that is complains better by abnormal discharge is psychotic miasm. Soric discharge is functional discharge, that is normal discharge. Tuberculosis discharges are characterized by offensive and debilitating. Syphilitic discharges are characterized by bloody and purulent discharge. Next question, for the treatment of intermittent fever, Dr. Hahnemann has advised to prescribe to the patient. First option, highly potentized solution of chinchona bark. Second option, Thuja occidentalis in crude form. Third option, antisoric medicine in low potency. And fourth option, solution of sulfur. So answer is C, for the treatment of intermittent fever, Dr. Hahnemann has advised to prescribe antisoric medicine in low potency. So seventh question, birthplace of Dr. Hahnemann. Options are Meissen, Gotha, Leipzig and Hertstedt. Answer is A, Meissen. Next question, who gave the name 50 millisiemel to the new method of dynamization? Options are first option Horace, second Gellert, C. Pyrie Smith and D. Bonny-Hassan. So answer is C, that is Pyrie Smith of Geneva. The details of this method was incorporated in the 6th edition of Organon of Medicine. Next question, dolichosm means. Options are A. Remove the disease, B. Remove the maintaining cause, C. Remove the cause and D. Remove the fundamental cause. So answer is C. Tolicasm means remove the cas. So the next question, the modus operandi of homeopathic medicines is explained in Organon of Medicine in which aphorism? Aphorism 26, aphorism 25, aphorism 29 and aphorism 39. So answer is option C, that is aphorism 29. So next question, Hahnemann used the word miasm in the sense of option A infection, option B influence, option C pollution, option C chronic syndrome. Answer is option A infection. It is mentioned in aphorism 33 and aphorism 72 of Organon of Medicine. So next question, what do you mean by subjective symptom? So options are first option which are narrated by the patient, second option which are narrated by the relatives, third option which are narrated by the patient in respect of his feeling, and fourth option which are observed by the attenders. Answer is option A, that is subjective symptoms are narrated by the patient. So next question, too short relief of symptoms after the application of a deep acting remedy means. Options are, first one, the remedy is to be repeated. Second option, the remedy is to be applied in higher potency. Third option, there is a structural change in the patient. And fourth option, the patient is of low susceptibility. So answer is option C. According to sixth observation, too short relief of symptoms indicate structural changes have already occurred or organs are destroyed. Next question, in a particular category of a disease condition, accessory symptoms are considered to be a very valuable guide in. Options are diseases of syphilitic miasm, second one one-sided disease, third one acute disease, and fourth one intermittent disease. So answer is B, that is one-sided disease. Actually one-sided diseases are soric in nature. Because of very fewer symptoms, it is very difficult for the selection of similimum. So in this condition, if any accessory symptoms are there, they may help to come across a correct remedy selection. So next question, if no improvement follows after the administration of strictly homeopathically selected remedy, options. First option, change the remedy instantaneously. Second option, repeat a fresh and small doses of the same medicine. Third option, change the potency of the remedy. And fourth option, administer a complementary drug. Answer is option C, that is change the potency. If no improvement follows after the administration of strictly homeopathically selected remedy, then you have to change the potency. So next question, drug dynamization was introduced in which edition? Second edition, third edition, fourth edition and fifth edition. Answer is option D, fifth edition. Next question, aphorism which deals with the characteristic symptoms. Option 1, 148 aphorism, option B, 152 aphorism, option C, 153 aphorism and option D, 154 aphorism. Answer is option C, 153 aphorism. Next question, the most efficacious time to administer medicine in case of intermittent fever. Option A, any time. Option B, at the height of heat paroxysm. Option C, during chill stage. And option D, very soon after the termination of paroxysm. Answer is option D, very soon after the termination of paroxysm. Next question, improving medicines are given to healthy person in options A, large doses, B, moderate doses, option C, minute doses and option D, single minute dose. So answer is B, that is moderate dose. Next question, third edition of Organon is known as option A, improved, option B, augmented, option C, improved and augmented, option D, original. Answer is option C, improved and augmented edition. Next question, after administering a remedy, the patient becomes better mentally with a few new symptoms. What is your inference? Option A indicated medicine, good response. Option B wrong medicine. Option C partially indicated remedy. Option D response in a terminal stage of disease, prognosis is unfavorable. Answer is option D response in a terminal stage of disease and prognosis is unfavorable. Next question, diet and regimen is described in. Options: aphorism 158 to 162, aphorism 245 to 249, aphorism 259 to 263, aphorism 264 to 268. Answer is option C, aphorism 259 to 263. So next question, surrogates means. Option A symptoms, option B remedy, option C drug and option D substitute. Answer is option D substitute. Next question, homeopathic drugs cure because of option A similarity of symptoms, option B minuteness of dose, option C potentization of drugs, option D infrequent repetition of drug. Answer is option A similarity of symptoms. It is said in aphorism 45 of Organon of Medicine. Next, final question of the day. Drug proving on healthy person was thought of for the first time by. Options: A. Hippocrates, B. Paracelsus, C. Hahnemann and D. Von Haller. Answer is option D. Von Haller. Thank you for watching. If you feel like this video is useful, kindly subscribe and share. Thank you all.